Hi, and welcome to Heavystones.com. My name is Mark Williams, and I practice traditional Chinese medicine. I recently had the good fortune to be able to get a sit-down with Jean Blake, the Chief Executive Director of the Parkinson Society BC. I was able to get some awesome insight into the workings of the Parkinson Society, and I'd like to share that with you right now. Hi, and welcome to Heavystones, and I'm here with my good friend Jean, and we're going to do a sit down and talk about Parkinson's today. Jean, do you want to introduce yourself?
I'll do that. I'm Jean Blake. I'm the CEO for Parkinson Society British Columbia.
Cool. I'm totally stoked to be here, talk to my good friend Jean. We've been trying to set this up for a few weeks now, and finally we're here. Okay, Jean, tell me, because I want to know, what's your background?
My background is in adult education. I have most of my experience, though, has been in healthcare. So besides the Parkinson Society British Columbia, I worked for Canadian Diabetes for 6 years, and I worked for the Alzheimer's Society British Columbia for 4 years. And prior to that, I worked in a hospital setting as the Director of Education for 14 years.
What got you into doing what you're doing for the Parkinson Society? What brought you to this point?
Well, the society has been needing to grow to assist people with Parkinson's disease because, unfortunately, the number of people with the disease is growing. Age is the number one risk factor, although about 20% of people with Parkinson's will have been diagnosed prior to age 50. But most people are 60 plus when they get diagnosed, and as a provincial society, we just needed to do more in terms of reaching out to more people and increasing our impact.
Let me backtrack.
Sure.
So I'm not sure. I know most people have heard of Parkinson's for sure, but maybe most people don't know actually what it is and how it affects you. Can you kind of fill that in for me?
Yeah. It's Parkinson's disease is the second most common neurological disease after Alzheimer's. And here in British Columbia, the government estimates there's about 13,000 people living with it. And most commonly, people will see some kind of a tremor, usually just on one side of the body. Rigidity. So a lot of people don't think about that, but because Parkinson's happens because of a lack of dopamine in the brain, and dopamine is the chemical that tells our muscles to move. Rigidity is a really big problem. So people may have phases where they're actually unable to move, or part of their body goes quite rigid, and that can be quite painful, as you can imagine. There's other things like sometimes, especially the feet can twist and be in quite uncomfortable positions. Those are probably the main hallmarks of the disease.
Tell me something, Jean. Why do you do what you do with Parkinson's? What motivates you to do this?
I think when we see that we're making a difference in people's lives, how can you not help but feel a commitment, a passion to helping others? So we run here at the Parkinson Society British Columbia. We have quite a range of services for being a small organization. We have short-term counseling, and it's offered by 2 clinical counselors. They each work for us 1 day a week. We also have an information and referral service. So we have incredible wealth of information on our website. It's also available in print. You can talk to a program staff, and they will put together a package of material and send it out. You have a question, even if they don't have the immediate answer, they will research it and they will get back to you. We run conferences across the province. We have a wonderful workshop for communication and swallow issues that's held by a speech language pathologist. And we also have 50 volunteer-led support groups in various communities, in 50 communities across the province.
I gotta ask you, when you started this journey, what hurdles did you face when you started on this journey of working with people with the disability of Parkinson's? What were the hurdles that you faced that you had to overcome?
Well, I would say the society is funded totally by individual donations. So we fundraise, we run a big super walk event every fall. We met at a Full Throttle event, which
we did.
One of our folks was holding as a fundraiser for us. And then just people believe in what we're doing. They see that it's making a difference in their lives, their families' lives, and so they donate to the cause.
What points would you like to get across? What main points would you like to get across to the people that are watching this video?
So one of the other things that we haven't talked about is the lack of access to care and therapy, particularly to trained health professionals that know about Parkinson's disease and therapies to help their patients. We have a provincial advocacy campaign called 4 Points for Parkinson's Disease. 4 Points for Parkinson's Disease.
Tell me about that.
You can also read up about it on our website, www.parkinson.bc.ca.
Right.
But the first thing is we would really like to have the government partner with us to create a provincial Parkinson's disease strategy so that it doesn't matter where you live in British Columbia, you can get access to the same care.
So, Jean, I know you're dying to tell me about the 4 point?
4 Points for Parkinson's Disease.
4 points for Parkinson's disease. Roll it.
We have a provincial advocacy campaign. First point is to get a provincial strategy so that it doesn't matter where you live in British Columbia, you can get the same access to care and treatment. The second is to get more healthcare professionals specialized in Parkinson's disease. Right now, to get in to see a movement disorder specialist who's trained in Parkinson's disease, it can be up to 3 years. There's a very small clinic that started in Kelowna, and he already has 1,200 patients on his wait list. So we need more specialists. We also need the allied third point. We need allied health professionals.
Third point.
Trained in Parkinson's disease therapies. So, for example, physiotherapists, speech-language pathologists, occupational therapists. We need nurses and pharmacists and to know about medication issues, particularly when someone goes into acute care, and GPs. GPs often don't see that many patients with Parkinson's disease, so it can be sometimes a couple years before someone even gets diagnosed and gets onto the proper medication regime. And then our fourth point. There's a therapy, again, for more advanced Parkinson's disease called deep brain stimulation. And currently the wait list to have that performed can be 3 to 5 years.
So this is the 4 points of a strategy
that we would like the government to assist with so that people are getting better care and treatment of their Parkinson's disease, can live better quality of life, and also reduce healthcare costs. Because although it's a complex disease, if people are properly treated, they can live in their own homes for a longer period. If they're younger, they can still work for a longer period of time. And as this disease also impacts a care partner, if the care partner is having to quit work to take care of them, you can see that that's also a cost to the economy.
Well, we got a lot. Right on. I want to thank Jean for joining me and for giving me her time today. I was totally stoked to do this, and thanks a lot, Jean.
You're most welcome.
And good luck with the program. I think it's a great cause. I really do, and well worth looking into. And if you want to help out, tell us where, Jean.
www.parkinson.bc.ca.
See you there.